Thank you very much for joining. So we've got another fertility talk, and it's still the month of March, so we're talking about endometriosis. And one of our final talks we have today is from Dr. Wynand van Tonder. And Dr. van Tonder is from Van Tonder, Wynand van Tonder Clinic, right? And you're a fertility specialist, but you're also at Hope, you're fertility specialist at Hope as well, Hope Clinic. And thank you very much for joining us today, Doctor.
Thank you very much, Leanne.
It's a pleasure. Yeah,
you want me to introduce myself?
Yes, please. I was just about to ask you, do you mind please introducing yourself? Tell us where you're from, what it is that you do.
Yeah, I'm Dr. van Tonder. I am an obstetrician and gynecologist, and I'm also a registered reproductive subspecialist. So I work at Hope Clinic, which is an infertility unit, and we mainly deal with fertility and endometriosis.
Yeah.
Yeah.
Thank you very much, Doctor. So today we're talking about the set of questions we're asking is regarding treatment options and management of endometriosis. And our first question we have for you, Doctor, is what are the goals of treatment for women with endometriosis, particularly those who are experiencing infertility?
Okay, so basically there are two main things we treat in endometriosis. The one is the pain leg, and then the other leg is the infertility options. And the infertility options, there's actually, on the medical side, there's no actual pre-treatment that we do. We either do surgery or we do infertility, IVF.
Yeah.
So deciding which way to go is sometimes very difficult.
Yeah. Yeah. Okay, yeah, our second question is, can you outline the various treatment options available for managing endometriosis symptoms and improving fertility outcomes?
Okay, so, we classify endometriosis patients in basically three groups. So the three groups are the women over the age of 35, the group in between 25 and 35, and then the group under 25. So in the group under 25, we mainly treat them for pain, and very seldom for infertility. So we try to treat these patients as conservative as possible. So without any surgical intervention. The main thing a lot of patients don't know is that nowadays laparoscopy is not necessary to diagnose endometriosis. We mainly diagnose this on the history of the patient and then ultrasound, and very seldom MRI scanning. So on ultrasound, you can definitely see your more severe cases of endometriosis. Okay, and then the group in between 25 and 35, they are usually the more fertile group. So you can adopt a more conservative infertility management, like sometimes we do ovulation induction, sometimes we do minor surgical treatment for your stage 1, stage 2 endometriosis, and then for your older patients and your patients with the more severe endometriosis, we mainly use IVF as a treatment modality. And the reason for that is that we want to get the patient pregnant, and we can get the patients pregnant in most cases without surgery.
Yeah. Okay, great. And then the next question is, how do treatment approaches differ depending on the severity of endometriosis and the patient's reproductive goals? Yeah,
So the main thing we know nowadays is that um, endometriosis affects not only the quantity but also the quality of your eggs.
oh wow.
So we sit in a dilemma that even young patients with endometriosis have actually got a very bad quality of eggs. So what we do is in patients with quite severe endometriosis, we might even motivate the patients at a young age of 25, 26 to already do fertility preservation or
Yeah,
harvest the eggs for, to give them basically um, options of fertility management later on in their lives.
yeah.
Uh,
Okay,
the other thing is The
sorry, you
other
can
thing
carry
is
on.
your more severe stages of endometriosis, we
Yeah,
normally do IVF and also in your older patients, because you don't have time because
yeah,
of this quality and quantity problem. So what we mostly do there is to harvest the eggs, make the embryos, and then if you need to do surgery before the transfer of the embryo, we will then do the surgery.
okay. Perfect. What I've actually had no idea that endometriosis actually affects your eggs. That's the first time I'm hearing about this. Thank you for that, doctor. Our next question is, what are the potential risks and side effects associated with different treatment modalities for endometriosis?
So I always um, say to people, um, with surgery comes a lot of problems,
Mm,
especially in infertility treatment. Firstly, the more you operate on the ovary,
yeah,
the bigger the chance is, um, that you will reduce the fertility potential of that patient or the egg count, and also the fertility potential. So we
yeah,
know that any surgery on the ovary reduces the egg count, and we don't want that for patients. So nowadays we are much more conservative as to surgery for endometriosis, because we know the effects are, it can also cause scar tissue in the pelvis. It can affect the blood flow to the uterus. It can affect even the tubal function and even cause blocked tubes. So in a lot of cases, it's mainly your minor groups of endometriosis, your stage 1, stage 2, that we
yeah,
might consider a surgical intervention. And then
yeah,
obviously, if you have big ovarian cysts, we won't remove the cysts. We will mainly drain the cysts and then do IVF.
yeah.
Previously, we would have removed the cyst and caused significant ovarian reduction in ovarian reserve.
Yeah. How I'm going to throw in a question here before going into the last question. How important is it when you're dealing with endometriosis and you have to at some point opt for surgery? How important is it to make sure that the person that is doing the surgery on you also has your fertility, takes into account preserving your fertility. So making sure that the person on the other end, the doctor, is someone that has actually got the background of fertility or is a fertility specialist. How important is that?
Yeah, it's very important. You see, the thing is you have to the doctor that firstly that operates the surgery of the patient for endometriosis must must have a extensive knowledge of the
Yes.
types of surgery and also the effects of surgery. And he must be technically capable of doing the surgery. The other thing is a lot of your severe cases of endometriosis, you actually need a surgical team that does these high-tech, very dangerous type of procedures. So the patients must make sure that they're going to somebody that can actually remove the endometriosis with safety, and also have a surgical team that's available to manage them completely.
Yeah. Thank you very much, Doctor. So our last question for you is, how important is ongoing monitoring and follow-up care for women with endometriosis, especially those who are trying to conceive or undergoing fertility treatments?
So as I spoke before about ovarian reserve,
Yeah.
So in patients with endometriosis, even if you treat them for pain, you must motivate these people, these women to do fertility preservation at a young age.
Yeah.
Secondly, to not have surgery unnecessarily. Like previously, we saw many patients that were operated 9-10 times for endometriosis because of pain. Nowadays, we mainly treat it medically, and it's only the case that you can't manage medically that you do surgery. So the ongoing monitoring is patients must do fertility preservation as soon as possible, and then have the children at a younger age. And if they have residual endometriosis, before we do the transfer of the embryos, to make sure the endometriosis is inactive or well treated, because in pregnancy it also has higher incidence of miscarriages, premature labor, and also preeclampsia and ruptured placenta.
Okay, thank you very much for that, Doctor. I really appreciate that you took the time out today, because I know you're very, very busy. You're leaving for Cameroon. So thank you for taking time out to be with us today and do this talk.
Hello?
Hi, I'm right here. Are you there? Are you there?
Yes, now I can hear you.
Okay, thank you for that. Sorry, so I'm saying thank you very much for taking time out to do the talk with us, because I know how very busy you are. So, Doctor, if you don't mind, could you please tell us how they can get hold of you? Anyone that's in the Gauteng area, I would say, how can they get hold of you if they are dealing with endometriosis?
So you can either contact me through the Hope Clinic, or you can phone my rooms at 011 463 4833, and make an appointment with my ladies, and then that's and also I've got also a email address, accounts at Dr. Wynand van Tonder.co.za.
Perfect. Thank you very much. So Hope Fertility and Dr. Wynand van Tonder, they are also on Instagram and on Facebook, and they've also got the website, and you're welcome to go to their websites and contact them this way. So thank you again, Doctor, and have a lovely day further. Thank you.
Okay, thank you very much.
Bye.
Bye.